There are two basic airway adjuncts. One is oropharyngeal airway or OPA, and the other one is nasopharyngeal airway or the NPA. So what are the indication of using the oropharyngeal airway or the OPA? If your patient is at risk for developing airway obstruction from the tongue or from relaxed upper airway muscles, then you have to use the OPA. The OPA is also used in unconscious patients. What else is the indication? Let's say you are performing a head tilt, chin lift, or jaw thrust, and these maneuvers fail to provide and maintain a clear, unobstructed airway, then you have to use the oropharyngeal airway or the OPA. What else? The OPA may be used to keep the airway open during bag mask ventilation when you might unknowingly push down on the chin, blocking the airway. So next question is, when can you not use the OPA? You cannot use the OPA if your patient is conscious or the gag reflex is active. So if your patient has an intact cough and gag reflex, then do not use OPA. So what are the techniques used in inserting an OPA? So number one, you have to clear the mouth and pharynx of secretions, blood, or vomit using a rigid pharyngeal suction tip if possible. And then after that, what are you going to do? You have to select the proper size of OPA. How are you going to do that? You have to place the OPA against the side of the face. When the tip of the OPA is at the corner of the mouth, the flange or the tail is at the angle of the mandible. A properly sized and inserted OPA results in proper alignment with the glottic opening. And then after you select the proper size of OPA, then you are ready to insert the OPA. And in inserting it, OPA should curve upward toward the hard palate as it enters the mouth. So as the OPA passes through the oral cavity and approaches the posterior wall of the pharynx, rotate it how many degrees? 180 degrees into the proper position. Or the OPA can also be inserted at what angle? 90 degrees angle to the mouth, and then turn down toward the posterior pharynx as it is advanced. And what's the main goal here? This is to curve the device around the tongue so that the tongue is not inadvertently pushed back into the pharynx rather than being pulled forward by the OPA. Another alternative method is to insert the OPA straight in while using a tongue depressor or similar device to hold the tongue forward as the OPA is advanced. So after the insertion of an OPA, you have to maintain a patent airway by keeping the head and jaw positioned properly and suction the airway as needed. So a word of caution in selecting the proper size of OPA. OPAs that are too large may obstruct the larynx or cause trauma to the laryngeal structures. If you have chosen an OPA that are too small or inserted improperly, it may push the base of the tongue posteriorly, and what's going to happen? It will obstruct the airway. So when you're inserting the OPA, you have to insert it carefully. What are you avoiding here? Soft tissue trauma to the lips and tongue. And always remember to use the OPA only in the responsive or unresponsive patient with no cough or gag reflex. So that's the keyword there, no cough or gag reflex. If the patient has a cough or gag reflex, the OPA may stimulate vomiting and laryngospasm. So what are you going to use if patient has cough or gag reflex? You cannot use OPA. And what can you use? Now you can use the NPA or the nasopharyngeal airway.